Our objectives for today are the following.
What is the relevance of IVF today? For students, most of you will get married and want to become parents one day. This early, you ought to know that there are declining rates of fertility and it will get worse. The global fertility rates as of 2010 are in general decline and is most evident in industrialized countries, especially in Western Europe, where rates are projected to decline dramatically over the next 50 years. The total fertility rates in the Philippines are the following. In the 1980s, it was as high as 4.75%. In the 1990s, it was 3.89%. 2000 to 2005 was 3.24%. And 2005 to present is 2.33%. And in the coming years, 2015 to 2020, it will be 2.10%. Caused by the increase in the use of contraceptives, poverty, and poor environment and health issues that result in infertility. In the States, people have babies in the midlife. Greater proportion of the US workforce delay childbirth until after their career is established. 16.67% of couples trying to conceive have difficulties mainly because of stress and environmental pollution. A man's sperm can be changed by his overall health and lifestyle. Heavy alcohol use, drugs, smoking, age, environmental toxins, health problems, medicines, radiation treatment for cancer can decrease the health or number of sperm. There are 800,000 reproductive-aged men and women with cancer that have concerns about their fertility. The following can increase a woman's risk of infertility: age, smoking, excess alcohol use, stress, poor diet, athletic training, being overweight or underweight, STDs, health problems that can cause hormonal changes.
IVF is a fertility procedure first succeeded in 1978 by Dr. Edwards, an embryologist, and Dr. Steptoe, a gynecologist in England.
In the Philippines, the total cost per cycle is around 264,000 pesos to 330,000 pesos. In the United States, the total cost per cycle is around 528,000 pesos to around 660,000 pesos. If additional assisted reproductive technologies are needed, it will cost more. For example, ICSI treatment, where a single sperm is injected directly into an egg, may be given an additional 44,000 to 66,000 pesos. The average number of cycles couples usually undergo before giving up for financial or emotional reasons is 4. A woman underwent 11 cycles in order to conceive and successfully deliver a baby. A study conducted by the New England Journal of Medicine states that a woman should undergo 6 cycles for optimal chances of getting pregnant.
Non-economic cost of IVF is elective fetal reduction. It is a technique that reduces the number of fetuses. It's used to convert a triplet pregnancy to a twin or singleton pregnancy to avoid a spontaneous abortion, or also known as miscarriage. In about 10 to 30% of multiple pregnancies, one or more fetus will be put to death and reabsorbed into the mother's body.
The first procedure is superovulation. This is when fertility drugs are given to the woman to boost her egg production. The second procedure is the egg retrieval. The doctor will extract the eggs from the woman by inserting a thin needle through the vagina and into the ovary and sacs containing the eggs. The needle will pull the eggs and fluid out of each follicle one at a time. Third procedure, insemination and fertilization. Insemination takes place where the man's sperm with the best quality eggs are stored in a controlled environment and are put together. Doctor may resort to intracytoplasmic sperm injection when the chance of fertilization is low. The fourth procedure is embryo culture. When the fertilized egg divides, it becomes an embryo. Couples can check if their future baby will have hereditary disorders through pre-implantation genetic diagnosis. Only 7.5% of all the fertilized eggs will go on to become live-born children. The frozen human embryos are more likely to be used in research or abandoned, rather than be allowed to continue growing in their mother's womb. The last procedure is embryo transfer. Embryos are placed into the woman's womb 3 to 5 days after egg retrieval and fertilization. Unused embryos may be frozen and implanted or donated at a later date.
The live birth occurrences are 29.31%.
Where did I come from is no longer a simple question. Twiblings aren't really twins because they are not related to each other. In fact, the IVF procedure needed 4 women and 2 men in order to be successful. It is most likely that the twins came from different sets of parents or donors. The biological relation of the IVF baby to its relatives is not as clear, an example of which is a grandmother who was also the mother who carried the IVF baby for her homosexual son. In the pre-treatment adjustment, patients were not experiencing depression. However, in the within-cycle adjustment, overall OPU and pregnancy tests proved to constitute the most stressful stages of the IVF cycle. The pre- and post-treatment adjustment, unsuccessful treatment tends to evoke an increase of at least depressive symptoms, which are not liable to diminish shortly after treatment. Successful treatment, on the contrary, tends to alleviate negative emotional responses. 25% of women are reported to have depression after 1 or 2 unsuccessful IVF treatments, but become better after psychological help. The long-term post-treatment adjustment, the stress disappears when pregnancy is achieved. On the other hand, women that have unsuccessful treatments adjust well. Out of 20,166 first-time pregnancies where only 1 baby was carried, there were 86 stillbirths, placing the overall risk of stillbirths at 4.3 per thousand pregnancies. A recent French study found that over 4% of children born through assisted reproductive technology had some form of congenital deformity, compared to the rate of between 2% and 3% for children conceived naturally. In fact, 2 out of 3 of IVF embryos fail to survive because of genetic abnormalities. Congenital malformation rates are as high as 11% have been reported by some studies of IVF children. IVF babies have twice the risk of some types of heart defects, more than twice the risk of cleft lip, with or without cleft palate, and over 4 times the risk of certain gastrointestinal defects compared with babies conceived without fertility treatments. In the US, cleft lip with or without palate affects approximately 1 in every 950 births, doubling the risk among infants conceived by ART, would result in approximately 1 in every 425 infants being affected by cleft lip. Women that undergo IVF treatment may also have ovarian hyperstimulation syndrome. The fertility drugs that are injected may cause the ovaries to become swollen and painful. In worst cases, it causes rapid weight gain, abdominal pain, vomiting, and shortness of breath.
According to the Philippine Constitution, Article 2, the Declaration of Principles of State Policy, Section 12,
the state recognizes the sanctity of family life and shall protect and strengthen the family as a basic autonomous social institution. It shall equally protect the life of the mother and the life of the unborn from conception. The natural and primary right of the duty of the parents in rearing of the youth for civic efficiency and the development of moral character shall receive the support of the government.
So, what does the church say about this? Psalms chapter 139 verses 13 to 15 say, "For you created my inmost being, you knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. Your works are wonderful, I know that full well. My frame was not hidden from you when I was made in the secret place, when I was woven together in the depths of the earth." Here, David joyfully acknowledges that Yahweh intricately wove him together in the secrecy of his mother's womb and foreordained his days with loving intentions. In Psalms chapter 127 verse 3, it says, "Behold, children are a heritage from the Lord, the fruit of the womb a reward." Children are not the fruit of chance, but that God, as it seems good to Him, distributes to every man his share of them. According to Donum Vitae, the gift of human life must be actualized in marriage through the specific and exclusive acts of husband and wife, in accordance with the laws inscribed in their persons and in their union. Life, once conceived, must be protected with the utmost care. Abortion and infanticide are abominable crimes. Genesis chapter 2, verse 24, it says, "That is why a man leaves his father and mother and is united to his wife, and they become one flesh. These two shall be for the production of one flesh. From their union a posterity shall spring, as exactly resembling themselves as they do each other." Every person must be respected for himself. In this consists the dignity and right of every human being from his or her beginning. Human life must be absolutely respected and protected from the moment of conception.